Good afternoon, everyone, and we want to welcome you to this very special webinar put on by Northern Caribbean University in this our homecoming 2020 exercise. We certainly had a wonderful experience earlier this afternoon at 2 o'clock when we launched the homecoming exercise for the entire week. But this afternoon, we are now gathered in this webinar session with our guest speaker, Dr. MELVA Spence, and she comes to us out of the second city, Montego Bay, Jamaica. Dr. Spence is a counseling psychologist and advocate. She has for more than 40 years facilitated the development of human capital and resources through mentorship, supervision, education, and training. She's a consummate professional with a penchant for working in underserved communities with disadvantaged youths. Dr. Spence possesses knowledge and experience in research and development of curriculum materials in parenting. Her work in the area of coercive parenting culminated in documenting of the work done by the Ministry of National Security, Citizen Security and Justice Program Parenting Education Model, a model that is adopted by the Ministry of Education, National Parenting Support Commission, and is shared locally and abroad as a best practice. She also has experience in delivering psychotherapeutic and social interventions to individuals and families, and in particular, at-risk youth and their families residing in volatile communities. Dr. Spence's academic achievements include a PhD in counseling psychology and a master's with emphasis in marriage and family therapy, both from the Northern Caribbean University. Her PhD is in marriage and family therapy, and her master's is in counseling psychology, both of which she got at the Northern Caribbean University. She also attained a Bachelor of Science in Elementary Education from Novus University in Davie, Florida, and a certificate in primary education from Church Teachers College, Mandeville, Jamaica. She holds membership with both the Jamaica Psychological Society and with Council of Professions supplementary to medicine. She's a practicing Christian and an ordained elder at the Lilliput Seventh-day Adventist Church in St. James, Montego Bay. She goes a long way in ensuring that she does what she does best. And she is one of those persons who embraces volunteerism and is very committed to encouraging young people to be on the road marked right. She, in her mantra, says, "A servant of God and friend to man." What more can we ask from our guest speaker this afternoon than to give her our undivided attention as she presents to us on the topic, the psychological effects of social distancing. Please help me make welcome Dr. MELVA Spence as she presents. Dr. Spence.
Let us pray. Loving Father, we are very grateful for your promises that are true and sure. They are new every morning. Into your hands I commit this presentation. In Jesus' precious name, amen. I want you to take a minute and reflect on where you were and what you were doing before our country was locked down, and also when the world was declared to be in a pandemic. COVID-19 has transformed the lives of every single human on planet Earth. And yes, in different ways. But things have changed for all of us. I want you to imagine how different your lives would be if your lives were allowed to continue as they were. We are looking at the psychological effects of social distancing. But I want you to bear in mind that regardless of the emotional challenges you may be facing,
I'm not sure where we
there
are
is a promise
just now.
from above. I will contend with him that contend with thee, and I will save your children. We are looking at the psychological effects of social distancing. What happened? There was a sudden disruption of normal routines as all activities took place in our homes. Work from home, suspension of physical classes, worship at home, commercial activities reduced to essential services. The world population is affected or infected in some way. Everyone is directly or indirectly involved. And so, the objectives for this presentation are: one, to look at the mental health implications of social isolation, and two, to assist in building the coping mechanisms of families by sharing prevention strategies to help reduce the effects. Let's look at some definitions. Social isolation, that's little or no contact with others. Social distancing, physical distancing, keeping space between yourself and other people outside of your home. And quarantine, a period of isolation, being kept away from others. I want to share with you a number of research that I looked at when I was preparing this presentation. The first one, it talks about the psychological impact of COVID-19, outbreak of college students in China. This is a longitudinal study, and it was conducted at the Institute of Higher Education, Agricultural University of Hubei in China. The study included 555 undergraduate students who were in confinement between January to March. The influence of possible stresses on the mental health of the students were investigated. They also looked at the states of psychological distress, depression, anxiety, and affectivity. The results revealed increases in negative affect and symptoms of anxiety and depression after 2 weeks of confinement. The second study was conducted at the Department of Psychological Medicine, King's College in London. This study was published online in February of this year. The study investigated the psychological impact of quarantine using 3 electronic databases of 3,166 papers, with 24 papers included in the review. The study reported negative psychological effects, including post-traumatic symptoms, confusion, anger, and stressors to include fear, frustration, boredom, and stigma. The third study was published in a Journal of Ideas in Health and this is a review article published in October of this year. The paper sought to address the psychosocial as well as other issues and their etiology as related to the current pandemic, COVID-19. This article is entitled "The Sequel to COVID-19. The social isolation as a preventive method may further induce mental health issues, and that psychological stresses in frontline healthcare workers, migrant workers, children, and adolescents are of serious concerns." The article further posits that mental other challenges such as uncertainty in the business arena, job losses, economic losses, hampered academic activities, increased screen time or social media, and domestic violence incidences can induce mental health problems. Let's look at the desk review of local studies. UNICEF and Caribbean Policy Research Institute, CAPRI, conducted June and August of this year. This study sought to examine various ways children are impacted and how Jamaica can respond to better protect them. The areas looked at were social protection, education, emotional health, and child protection. The findings revealed, as it relates to emotional health, that most household respondents reported increases in a number of areas. Children's level of boredom, 63% of the respondents reported increases. Overeating, 57%. Frustration, 41%. Clinginess, 49%. Anxiety, 23%. And fear, 21%. There were also marked increases. Screaming or calling the children names were more frequent than they did prior to COVID-19 restrictions. Approximately 15% said that children were spanked, hit, or slapped more frequently since the start of COVID-19. 1 out of 20 respondents said that this kind of venting was much more frequent. A study that was conducted by the Mona Aging and Wellness Center surveyed 313 senior citizens between July and August of 2020. The findings showed that more than 80% of the respondents are concerned about being lonely due to COVID-19, while more than 60% are worried about the medication running out, and more than 60% have not sought medical care since March. This study was published in the Gleaner of October 15, 2020. The World Health Organization also conducted a survey, and the survey was conducted from June to August 2020 among 130 countries across World Health Organization's 6 regions. It evaluated how the provision of mental, neurological, and substance use services has changed due to COVID-19, the types of services that have been disrupted, and how countries are adapting to overcome these challenges. The COVID-19 pandemic, they found, has disrupted or halted critical mental health services in 93% of the countries worldwide, and this at a time when the demand for mental health is increasing. More than a third, 35%, reported disruptions to emergency interventions, including those for people experiencing prolonged seizures, severe substance use, withdrawal syndromes, and deliriums. They also shared that over 60% reported disruptions to mental health services for vulnerable people, including children and adolescents. This was 72%, older adults 70%, and women requiring antenatal or postnatal services 61%. 67% also saw disruptions to counseling and psychotherapy, and 65% to critical harm reduction services. In the Observer of Monday, April 13th, 2020, Dr. Dennis Edwards, a neuropsychologist, states that he believes that restrictions imposed on physical contact to contain the spread of the virus run contradictory to our Caribbean social norms. He stated, and I quote, "We as Caribbean people are more interactive. We tend to always be touchy-feely, gregarious, and outgoing. And in a context like this, it is putting a toll on Caribbean people's emotions. Social distancing, or more accurately, physical distancing, is not the Caribbean way." End of quote. Personal experiences. The pandemic has created situations that nobody has ever lived through. But we have research and professionals to guide us through this time of social isolation. In my professional field, I am experiencing increases in the number of clients who are experiencing stress, depression, and anxiety. Approximately 60% of clients seen are experiencing depression. So let us summarize the impact based on desk review and professional opinions. They are revealing increases in persons experiencing psychological distress, depression, anxiety, affectivity, and stress as a result of social isolation. There is also the possibility of developing symptoms of PTSD as a result of being quarantined. What are some of the effects? Persons are experiencing symptoms such as, and these are adults, detachment, irritability, decreased work performance, poor concentration, sleeping too much or too little, low mood, and many other effects. For adolescents, they may experience symptoms such as reduced academic performance, increase or decrease in appetite, fatigue, loss of interest in activities once enjoyed, poor sleeping, and social withdrawal. For children, they may experience symptoms such as fear, weepiness, nightmares, regression, example bedwetting, and academic performance. Parents, I want you to remember that children take their cues from the adults around them. So what are the mental health implications of these effects? Negative impacts to mental health due to worry and fear. Existing mental illnesses among the population may deteriorate. Access to mental health services could be minimized with the closing of schools and other institutions, increases in suicide ideation and domestic violence, increases in the use of harmful substances, burnout, especially in frontline workers. So how can we navigate the emotional trauma of COVID-19 pandemic? Here are a few suggestions. As best as possible, maintain your routines. Spend time on the outside. Schedule breaks in your daily activities. Provide time for each family member to express feelings without censorship. Prepare your family for the steps to take if a family member becomes sick. Observe family members for unusual changes, that is, signs of stress or anxiety. Children will need to be comforted and feel safe. They will want to be hugged. As parents and caregivers, this should be safely done. I also want to encourage parents to be mindful of what your children see or hear on television or online. Too much information can be overwhelming for them. Help them to sort through the information. Manage your own anxiety, parents. Remember, your children take their cues from you. So it is good for you to maintain structure and routines. Structured days with regular meal times and bedtimes are an essential part of keeping them focused as well as keeping them happy and healthy. Overall, children do better when their activities are predictable, and therefore, whenever possible, inform them about your change in routine ahead of time. Parents, I also want you to know that children often worry more about family and friends than themselves. Letting them call or video chat with friends and relatives can help them feel reassured about the ones they love. Help your children to feel in control when possible. Children feel empowered when they know what to do to keep themselves safe. Take any opportunity to let children feel in control, but do this with limits, by allowing them to make choices or to take steps to keep healthy. You, as a parent, can encourage structured and unstructured time, as well as supervised and unsupervised time, as is appropriate. Be a good role model to your children. Children learn most from what they see their parents do. Therefore, think of setting a good example of taking care of your physical and mental health. If you find children to be excessively focused on negative thoughts and outcomes, help them to think more in a more optimistic way. If you're worried about someone's mental health, call a mental health professional. It is important that you seek professional psychological or psychiatric help where necessary. In closing, I want to encourage each and every one to be engaged in religious and spiritual activities. This is a good time to craft this as part of your daily routine with your children. Organize daily a time for reflection and the expression of gratitude. So let us walk through Philippians 4. Verse number 4 says, rejoice in the Lord always. And again, I say rejoice. And take note, it is important that you rejoice. Both rejoice are in capital letters. This is what is so unique with the NCU product, Christian education. And we can always turn to God's words when we are anxious, depressed, and experiencing fear because of restricted guidelines from this COVID-19 pandemic. When we look at the Bible commentary on Philippians 4, it states that Paul understood that many of us seem unable to comprehend. He was intense, he was in earnest. His words show that his mind was centered in Christ, that his whole life was bound up with his Lord. He admonished us to rejoice. He does not want us to be sad and depressed. And so verse 6 encourages us that in prayer and supplication with thanksgiving, we should let our request be known unto God. And the promise in verse 7 is that we will have the peace of God, which is beyond understanding. Verse 8 says, finally all, whatever things are true, honest, just, pure, lovely, and of good report, if there be any good value, and if there be any praise, think on these things. Verse 13 states, you can do all things through Christ who strengtheneth you. And verse 19 states that our God shall supply all our needs according to his riches in glory by Christ Jesus. So you see, friends, there is no need for fear. There is no need for worry, to be depressed or be anxious because we are restricted physically or socially. We can navigate with God the emotional trauma of COVID-19. Thank you.
Thank you very much, Dr. Spence, for your presentation. I have been tremendously blessed by it, and I'm sure that those who are following us on YouTube have been blessed and encouraged. And I am hoping that the questions will come in so that we can hear you respond to how some individuals have felt when having listened to you. Do we have any questions coming in? While I prepare their questions, Dr. Spence, I would like to ask this question because I heard you speak about the article on the sequel of COVID-19, and you identified one of the things that bothered my mind a little when you said that the elderly suffer the most. The article says the elderly suffer the most and it may produce mental issues. Could you elaborate a little on this for us? Please unmute your mic.
Are you hearing me, Dr. Peter King?
Yes, I'm hearing.
Okay, good. What we are realizing is that because of fear, the elderly, they are listening to the guidelines to stay at home. And as a result of that, they are staying inside. And you must remember that many of them already are on all types of medications because of other kind of physical illnesses.
Yes.
Also being in isolation, not being able to reach out to others, and many of them maybe don't have family members. If you remember, some of the research was showing that their places of socializing would have been in churches, or when they go out to the stores to do their shopping and all, taking care of day-to-day activities. Now, all of this was cut off. And what the article found out was that persons were not even visiting their doctors. And so we know from the research, and even before that, that persons who don't have any kind of a physical contact, or who are not stimulated mentally, especially the adults, that this can even lead to greater degree of mental illness as it relates to depression.
Yeah, I find in the presentation where you continue to say that quarantine is not good. I feel that that is pose a major problem, because whenever we meet in contact with anyone who basically is not from our house, especially somebody who has traveled abroad, we are encouraged to quarantine. Whenever a visitor comes in, the person quarantines. And if you travel out, you are quarantined. What type of effect is that really having on the populace at this time?
Okay, what is happening is that quarantine is one of the best ways to contain the COVID, the disease. Yes. So I'm not saying anything is wrong with it.
Yes.
What I'm saying, it's the fear that is causing persons, because just imagine, Pastor, you are locked away, you are isolated, you're thinking about, our culture, how we are not ashamed to let people know that we don't want you around. So you can understand the mental strain on persons who have to be isolated, and then that is known to other persons. So there is a fear of people returning to their homes, because even sometimes in their homes, they are experiencing this kind of a stigma and biasness towards them having that kind of an illness. And so persons just don't want to share. And just having to hold that secret in, not allowing someone to know that you were infected, can be very hard on persons who are quarantined mentally.
Oh, let me move the conversation a little, because in the presentation, I gather you to be saying that it was an increase in abuse. There's an apparent increase in the abuse of young children because of this staying at home situation. And I find that quite troubling at this time, that parents become agitated, caregivers become high-handed, and the children are the recipients of their outbursts of their anger. Could you tell us or share with us how this can be helped? Because I find that, well, I don't have any children at my home. I am one of those empty nesters. But sometimes I do find that I kind of feel a little bit impatient. Personally, I feel a little bit impatient. I don't see things going. And is that a result of my being locked home? What is it? And how can we help not beating up on our children because of this COVID imposed jail time?
You must remember, Dr. Peterkin, that we had a routine. We were always free to move as we feel.
Yes.
Parents, many of the challenges, financial challenges, no work, They are not trained teachers. And so here they are. They have to be struggling with doing their work and also struggling with learning how to share with their children, to assist them with the schoolwork that they have to do. And if you're thinking about how are we going to manage, how are we going to live, I might not have any job, I can't go out to work, there's no income coming in, and now on top of that, my child is home, I am the one who has to be assisting, as playing the role of the teacher. Then also there are issues. Just today I spoke to a lady, one of my neighbors. I noticed 2 little children were there. And so I stopped, I called her out. I said, why aren't they in school? And she said, and when I say in school, I mean, why aren't they being engaged inside?
Yes.
With their equipment? And she said, listen, one of them has a tablet, but I don't have the money to buy the data to put on the tablet. And the other one, I don't even know how to connect with the school in order to get the information. Yes. So you can only imagine, you're already not doing so well as a family, and you're looking at your children losing out on their education. Definitely that can cause some strain because you're looking into the future. These might have been the persons that you were looking to assist you out of poverty. Yes. Then you must also remember that as it relates to spousal relationships, yes, many of the times being out, whether it is in church, interacting with other persons, or going to work, interacting with other persons, that's where people get respite from being engaged with people who they're not getting along with at home. And yes, so definitely you can see where the rise and the spike would be in this impatience and this lashing out of the persons who are nearest to you. So what I would want to encourage parents to do is to take a minute. It's not very easy, but to be mindful of what is going on in their thoughts. Because most of the time it is what we're thinking that spur us to act. So I would like to encourage parents to think about their thoughts. What am I thinking at this time? And they might need to take a break, take a little walk, breathe easily, take some deep breaths. Those things really do work. These simple little things that we have been hearing all our lives, they do work. So they might need to connect with their thoughts, then try to rephrase the frustration. So if right now I feel like I'm going to hit this child and flatten her on the ground, they might want to think and rephrase and be more positive in their thinking by saying, I know my trigger right now is because of this or that, and so I'm going to wait before I address the situation that is frustrating me.
Okay, I have a final question for you as we wrap this session up, Dr. Spence. And the question is, I am going into your Christian mind, and I go to church, and they told us we have to be social distance or physical distance, and you cited one of your sources as saying that social distancing is not the Caribbean way.
Oh.
Not the Caribbean way. And we find that when we go to church and we social distance, it has reduced the number of persons who can come in to the body of the church. And at one time, I recall informing an adult who is much older than myself, she's in her 80s, that she can't come to church. She cannot come to church because of her age, and we have to ensure that she remains safe. And her response was, you want to kill me at home? So you are at church, you can't let it, and you can't come, you're at home. What do we tell people at this stage? Because we are now about to, if not entering into the second phase. Some countries are UK, they have gone into a second lockdown. Others are going in, while some people are not going back into another shutdown. What do we say at this time? How do we encourage everyone in this milieu of social distancing? How do we walk them through and at the same time ensure that we all are safe?
So we have to try to repeat, educating them, repeating the same thing over and over. We just have to try that. It's not very easy, but there are things that we can do. We can visit, we can stay by the gate. My granddaughter, who lives abroad, she has taught me how to air five. She said we don't have to high five anymore, we can air five. And this was her argument when she wanted to go back to face-to-face class. She said, I don't have to hug them, I can just air five them, meaning she can just air five, hold up her hand, and they can hold up their hands. So that might be one way that we can get around it. We used to throw kiss, we can do that. I have found that when I called, I made it a part of my duty to call most of the elderly in my church, especially those whose numbers I have. So I try to reach out to them every 2 or 3 weeks. And I find that also helps, because at least they know that we're thinking about them and we have not forgotten them. So we can call, we can try to find out from them if there's anything that they need that we can get for them. One lady I remembered, when I called, she said, I don't know how to get my pension, I don't know when it coming and all like that. I was able to call the post office and let her know when to go there exactly. So they might not be able to come to church to get that social activity, but we can maybe assist them in other ways to let them at least feel that they're still alive and we're still looking out for them and they're not forgotten. We can also do what we call FaceTime with them. We can call them on the WhatsApp, do the video calling and engage them. But we have to follow the guidelines set out by the Ministry of Health. And so we just can't break them to make persons feel wanted and accepted.
Thank you very much, Dr. Melva Spence, counseling psychologist and advocate, coming to us out of Montego Bay, Jamaica. And thank you so much for having been with us. I'm sure that those of us who are following on YouTube have been blessed, that those of us who watched you on Zoom, we have been inspired. And we know that if we put to practice that which we have heard, we will be better off as we try to weather the dynamics of COVID-19. We want to thank you for the time spent with us. And we want to wish everyone be safe, God's blessing, God's peace and protection throughout this week. For those who can join us, keep joining us each day as we move into the various colleges in presenting. And as our alumni from all across the world join us through this week of Homecoming Week 2020 from November 2 to November 8. Thank you once more, Dr. Spence, for having been with us. God bless.
Welcome, Doctor.
And have a great evening.
You too. Thanks. Okay, Doctor.
Second only to the annual graduation exercises, the annual homecoming of Northern Caribbean University has been a deeply treasured tradition of the institution for many years. It is the occasion when the entire campus community comes alive for a week or weekend of exciting activities involving alumni, friends, current students, and the entire university family. It is the occasion when alumni from far and near return to campus to relive some of the experiences that have shaped their lives and helped them find their purpose for living. It is the time when old friends come to renew former associations and catch the NCU spirit once again. So as at all of the times before, this year, the university family looked forward to the packed auditorium on Homecoming Sabbath, the approving smiles and warm hugs from alumni and friends not seen since last year or for many years before. We looked forward to the annual homecoming football match between the alumni team and the President's 11. We anticipated the amazing transformation of the gym into a resplendent banquet hall to accommodate our usual fundraising event. But alas, COVID-19, and everything changed. But just as we were about to despair, the idea of Homecoming 2020, a virtual affair, was born. It will be a week-long series of online events, a week to interact and reminisce, to have fun and laughter, to worship and share, to be edified and inspired, to reflect and recommit as we gather together to celebrate the alma mater and to contemplate her role in our lives and in the society in which we live. So welcome to Homecoming 2020, a virtual affair, the homecoming experience like none other, a time to refocus, reset, renew,